So what is the connection between, well, actually, let's talk about the default mode network, because I'm thinking maybe that's a bridging idea that it seems to have emerged as an important factor in psychedelic speculation about what's happening with psychedelics, what it's doing to the brain. So talk to us about the default mode network and whether or not your device is also able to affect that network.
So we don't know for sure whether Apollo is able to affect the default mode network yet. Those will be very interesting studies that will hopefully be done over the next couple years.
Mm-hmm.
Uh, but what we do know is that psychedelic medicines affect the default mode network activity, and that's thanks to the work of Dr. Robin Carhart-Harris from Imperial
Yes,
College of London.
right.
And what the default mode network is, for those who don't know, is it is a neural network in the brain, in all of our brains, that when we're at a resting state, just kind of sitting in an fMRI, a functional magnetic resonance imaging machine, which measures our brainwave, our brain activity, and our brain structure. It's a network of connection between certain parts of our brain that is consistent with the experience of ego or our sense of self identity. And that what that means is that as we do activities that strengthen our sense of self identity or ego, um, it tends to increase activity in this network. And when we use medicine, which Dr. Carhart Harris shown, when we use medicine like medicines like psilocybin, and you measure these same networks in the brain in people, that the psilocybin causes a what's called a dissolution of the default mode network. So the same parts of the brain
Mhm.
in the default mode network, which is a large part of the brain, are all active still, but they're not talking to each other in their normal pattern. So the
Okay.
default mode network is a normal pattern of firing that happens in the brain when we experience life in our day-to-day regular conscious state, our
Okay.
regular waking state. So you
Yeah.
take a psychedelic medicine, it causes a disruption of that network so that the parts of our brains are still fully active, maybe more active actually, but the parts of the brain are talking to each other in a free way. So
Mhm.
the best way to think about it is if you ski or snowboard, everybody knows the typical runs. You ski down a run that thousands of people have skied down before, and you follow somebody else's tracks, and that's the tendency, or your own tracks. However, imagine being at the top of the same mountain and you have 8 feet of fresh powder drop on you, and now you can decide wherever you want to go right then and there without any preconceived notion. And that is dissolution of the default mode network. And Carhart Harris showed that this correlates with loss of ego and sense of self. So in a dose dependent manner. So the more psilocybin you take, the less default mode network activity you have, and then the less sense of self and ego you have. So they're all directly related to one another, which is fascinating.